10 years ago, I was diagnosed with endometriosis and adenomyosis and was told my life was over. I was told to drop out of university, I'd never have a career, I'd never have a relationship or a family, and to basically go home, put myself on benefits, and be ready to be cared for the rest of my life. So I went on a mission to change my life forever. I dove into holistic health, alternative medicine, and made sure that I became the expert on my body. And 10 years later, I've proved the doctors wrong. I've transformed my lifestyle, learned how to pay the healthcare system, and my endometriosis is now in the best place it's ever been. In today's video, I'll be sharing the 10 most bizarre endometriosis symptoms that women experience, what they mean, what you can do about them. Oh, and number 10 will blow your mind. Number 1. Chronic UTIs, urinary tract infections, which is a bit of a mouthful. These are horrible. They are so horrible to experience. I have had so many in my lifetime. I went through a period at university where I literally had them every single month, if not more often. I'd have an infection, I'd go on antibiotics, I'd have maybe a week or a few weeks, and then it'd come back all over again. And it is so easy for women to get stuck in vicious cycles of UTIs. But here's the thing. You may find that you've been experiencing the awful UTI symptoms that you can get, where it's like you can't stop weeing, you're constantly going to the toilet, it's painful to urinate, there's stinging, there's burning, you can feel like pressure in your pelvis and like really deep down. The symptoms are awful, and maybe you're feeling all of this and you feel like you keep getting UTIs, but every time you call the doctor, you do a urine sample, they send it off, and then they come back to you and say that there is no sign of a UTI and nothing is wrong with you. And that blows your mind because it feels horrendous and it feels so much like a UTI. And the reason might be that endometriosis could be growing on or around your bladder. And this growth of endo can actually make you feel like you are having chronic UTIs, even when potentially the bacteria or the tests that they do are coming back completely clear and the bacteria might not even be growing there. When it comes to endometriosis growing on the body, endo outside of the pelvic area, so outside of that reproductive system, two of the most common places that it then goes to tends to be the bowel and the bladder. I hear this so many times. So many women have endo on their bowel and bladder as well as other places in the body. So chronic UTIs, you could be looking at endo on your bladder. Number 2. Shoulder pain, and I'm talking shoulder pain like right into this bone here. It could be like stabbing in the side, stabbing on top, throbbing, pulsing, and what seems to be really common is it tends to be right shoulder pain. Now it can be both. It doesn't have to be one shoulder or the other. It could just be one side, it could interchange, it could be different month to month. Any kind of pain is very indicative of endometriosis, and it could be telling you two different things. So shoulder pain is very common when it comes to thoracic endometriosis. Your thoracic cage is this section of your body. So we're talking about your lungs and your diaphragm and anything that's kind of respiratory. And shoulder pain is quite often linked to thoracic endometriosis. I've experienced a lot of thoracic endo symptoms, including shoulder pain, but what's really interesting is in my latest surgery, they found no endo in my thoracic cage. And this is the other reason. It could be because where endo grows in the body, you can often have pain in completely different areas to where it's growing. So maybe if you have it growing in your pelvis, you could actually have pain in a completely different area. Or potentially, if you have it growing on your nerves, it can also show up in literally any other part of the body. So shoulder pain could be endometriosis. Number 3. Breathlessness. Girl, if you feel like some days out of the month, maybe it's leading up to your period, maybe it's ovulation, maybe it's when you're bleeding, and you suddenly feel that you are the most unfit person on the planet because you can't walk up the stairs without being out of breath. You try and go for a walk and you just can't catch your breath. Maybe you're even lying down watching the TV or literally doing nothing at all, and it feels like you've got a layer of bricks on your chest and it is impossible to breathe normally or feel like you've got your full lung capacity. We could be looking at endometriosis. This is another potential thoracic endo symptom, just like the shoulder pain, breathlessness, a tight chest, any kind of pain up here in the diaphragm, in your kind of breathing area. That could be endometriosis, both thoracic or otherwise. Number 4. Rectal bleeding. This is not pleasant. I know this is not pleasant, and we can all get a bit squeamish and a bit like icky when we talk about bowels and bladder and poo and rectum and all the rest of it. But it's a really important symptom to know about. If you are going to the toilet and when you are passing stools, you are seeing blood either in the toilet before you pass the stool, in the stool itself, or after you've passed that stool when you're wiping or in the toilet and you are seeing blood, that could be a symptom of endometriosis. This is a tricky one because it can also be a symptom of some other conditions that are a bit more severe and a bit scarier, and people often get quite freaked out when we talk about it. But rectal bleeding and any kind of bowel pain when you're passing or need to pass or just after you've passed, all of that together could be indicating bowel endometriosis. Number 5, joint pain. This one really stings me, and I still struggle with this occasionally. So joint pain can be excruciatingly painful. I often have it in my fingers, in my wrists, in my elbows, my shoulders, my hips, my knees, and even my ankles and my toes sometimes. So that is what we mean by joint pain. It is feeling like potentially you've got bolts of electricity running through those joints. Maybe someone's stabbing those joints. Maybe someone's like pulsing those joints. It is any kind of pain, whether it's what I've mentioned or something else, and it feels like it is right in these joint bones or right in your fingers or right kind of in like the tip of your elbow here or your knees, wherever it might be. Really painful joints that suddenly come out of the blue. Maybe they stay for a few hours, maybe they stay for a few days. That can be a sign of endometriosis. We know that endo is a systemic inflammatory condition, and we quite often see a connection between inflammatory conditions and joint pain. We don't 100% know why, but there is definitely a connection there. Number 6, this is a rarer one, but it can happen. Coughing up blood or bleeding from your nose, or even sometimes bleeding from your eyes. Any kind of bleeding from like the upper facial or kind of respiratory area could be a sign of endometriosis. This can link back to thoracic endo, but as we know, endo can grow anywhere in the body, and there's even been cases of endo growing on women's eyes. So if you are coughing up blood or having nosebleeds or any kind of blood from the eyes, that could be a sign of endometriosis. It is quite an obscure one, but it is definitely possible, and there have been plenty of recorded cases. Number 7, leg pain and numbness. Again, if I'm going to have some endo pain, this is occasionally one that really kicks me up the arse. So we know that we can get pain all over the entire body, but what's a bit weird and a bit disconcerting is when you can sometimes get like electrical or throbbing shooting pain from your lower back down into your hips, down into your bum, and then through your legs, and sometimes through the knee and the lower leg. And this can feel like someone is sending electricity through your legs or bolts of lightning, and it is a really disconcerting, weird feeling. It can be extremely painful. It might stop you from walking. It might feel like you've got the most extreme version of cramp and you cannot get rid of it. And you can also have complete numbness in sections of your legs where you know that your legs are there, you know that you could stand up and you could walk on them, but maybe your thigh feels completely numb. Maybe one leg feels numb and one leg feels normal. So numbness and any kind of lightning pain or shooting pain in your legs is definitely a sign of endometriosis. Number 8, this is connected to a previous one, but very painful bowel or bladder movements. Again, we can all feel a bit weird talking about this, but it's really important to highlight. If you are getting pain when you feel like you need to go and relieve yourself in urination or passing a stool, you've got pain beforehand, you can almost feel things happening in your body, and that is causing you pain because you feel like you need to go to the toilet, and that kind of message to your brain that you need to go becomes painful, could be a sign. When you're actually urinating or you are passing stool, if that process is painful, maybe you feel like it's like stabbing through the vagina, through the bum, someone is putting a knife up there, it is sharp, it shocks you, you kind of jump up when you go to sit down, or the actual movement of kind of the clenching and the muscles moving is really painful, again, it could be a sign of endometriosis. And if you feel like you have relief but also pain after you've been to the toilet, and you are cramping in your pelvis, in your back, in your bum, anywhere, all of those different types of pain could be signs of endometriosis. Number 9, we're almost there. Number 9 is dizziness and lightheaded. So if you are constantly feeling really lightheaded, really dizzy, and almost like you're a little bit spaced out and you're not quite there, you're not quite grounded, something just feels a bit off, and you're constantly like up in your head, maybe the room is spinning a little bit all the time, you constantly feel a bit nauseous, a bit dizzy, a bit lightheaded, that low level suffering could be a sign of endometriosis. This is also often linked to when we have really heavy bleeding. So if you are bleeding longer than 5 days, so maybe like 7, 10 days, if you are spotting throughout the month, if you are changing tampons or sanitary towels every hour, maybe you have to use multiple things at one time because you bleed through, anything connected to heavy bleeding, or even if you don't have heavy bleeding and you just feel constantly dizzy, nauseous, lightheaded, this could be a sign of endometriosis. Number 10, we've made it. This is the craziest, most obscure symptom of endometriosis that I've only learnt very recently. I've never experienced it myself, but I never ever in a million years would have thought that this would be endo, but it could maybe unlock some really tricky symptoms for you. This is called sticky feet. So if you are walking around with shoes on, without shoes on, or just being around the house and you feel like the ball of your foot is constantly sticking to the surface, to the pavement, whatever it might be, and every time you move your foot there's a little bit of resistance, there's a little bit of stickiness here, that could be a sign of endometriosis. And it is really incredible how we know that. That feeling of sticky feet could be a sign that endo is growing on your sciatic nerve, and it is putting pressure and compressing the sciatic nerve in your spine, and that could be creating some problems in your back at the lower end of your spine, and that is a sign that endo might be growing in that area. It is so bizarre. I had never heard of it before. Maybe you've experienced it. Maybe that's the only thing you've ever experienced. But if you are getting sticky feet and maybe some back pain or some spinal pain, this could be endometriosis. So if you're getting some, none, or all of these symptoms, what can we do about it? Well, first things first, every woman on the planet, whether she has a condition or doesn't have a condition, should be tracking her cycle. It is so helpful for us to know what are our full phases like, how long is our follicular phase, how long is our luteal phase, when are we ovulating, are we even ovulating, is that even happening, what is happening in our cycle, and how do we feel as we progress through our cycle. If you are on contraception, you can still do this. Yes, it is suppressing your hormones and it is suppressing your cycle, but you are a cyclical being and you can still do this tracking and see how you go throughout the month. Personally, I absolutely love Stardust. I think it's a fantastic app and it's my favourite one to use. Second, track symptoms. I want you to track everything to do with these symptoms. So every single symptom you experience, when you experience them, time of day, what have you done just before it? What do you do after it? What have you eaten that day? What have you eaten or drank around it? I want you to track every symptom and I want you to think about the triggers and what is potentially making them better or making them worse. There is no such thing as too much detail, too much information. Put everything down that you can possibly think of, because you never know what is going to be that key that unlocks your diagnosis or unlocks the next treatment plan for you. It could be the teeniest, tiniest detail that is exactly what the specialist needs to know. And then the final thing I want you to do is to make sure that if you're not already under an endometriosis specialist, I want you to get yourself under one. If you're going to the GP and you're very early on, maybe you haven't got a diagnosis, but you're getting a lot of endo symptoms, then go to the GP and start that process of investigation. It is going to be a long road. It's not necessarily going to be a straightforward road, and you may have to wait quite a long time, but it's so important that you start the process. GP to gynae, get that gynae referral, go to gynae, see what they say, push for more scans and tests. If they think it's endometriosis, push for a diagnostic laparoscopy. That is the gold standard of diagnosis for endometriosis. Once we then get that diagnosis for endometriosis, then we are going to a specialist, girl. You deserve a specialist clinic. You deserve to see a specialist for endometriosis. The GP and the gynae are capped of what they can do. They can do community support. There may be other things in your life that they can help you with, but when it comes to endometriosis, you deserve a specialist, and make sure if you want one, you go and you push for one. Women with endometriosis might have some, none, or all of these symptoms. No one case is the same. There is no textbook, no perfect. If you have any of these symptoms and you are worried, please go and get investigated. I am always here to help with any questions, concerns, or worries. Put them in the comments below. I will do my very best to try and help you. If you are feeling lonely or isolated on your journey, I totally get it. I've been there. You can listen to It's Not Just a Period, because it's an incredible community of women going through exactly what you're going through right now, talking about everything that we've discussed today and more. If you've enjoyed this video, please give it a like and subscribe to the channel. It will be a huge help. I can't wait to see you soon, and please keep looking after you.